Welcome to this post-tea session on the morning of the first day of this unique conference on health psychology. I'm going to kickstart the session with my first with the talk, which I've titled "Matters of the Heart: Is It All in the Mind?" I'm proud to say that I'm an alumni of Rani Sidayachi Higher Secondary School, which is in Annamalai Nagar, Chidambaram, and it was this wonderful school which launched me on to my medical career to Chennai. After finishing medical school, I went abroad to the United Kingdom, where I had the privilege of working at Leicester Royal Infirmary. I had my pediatric training there, and that institution set me on the course for a career in pediatric cardiology. So I was very thrilled when Professor Virdagirinathan asked me to give a lecture at this talk, which I see is supported by the University of Leicester and Annamalai University. I found this a very intriguing coincidence. Being a conference on psychology, I would say it's probably not a coincidence, it's probably meant to be. Well, this is, our next speaker is going to be speaking on other matters of the heart, but when Dr. Virdagirinathan asked me to do this talk, I kind of combined both. I did medical as well as some aspect of the psychological cardiac psychology. So for the first half of the talk, I'm going to introduce the complexities of the heart disease in human beings. So I'm going to be that person. And for the second half of the talk, I'm going to talk on other matters of the heart, and I'm going to be that, not necessarily Cupid. So when we talk about heart disease in the human being, we can very broadly classify it into congenital heart disease, which are birth defects of the heart. Now, congenital heart disease happen about 8 to 10 per 1,000 live births, and it could be a very simple hole in the heart when we call it a acyanotic congenital heart disease, what we call VSDs and ASDs and PDAs. Many a time these holes are completely cured when diagnosed, and the child is able to grow up into a normal adulthood and lead a normal quality of life. But when we talk about acquired heart disease, these are heart diseases that are acquired in life. So the child is born with a normal heart, and during the course of a lifetime acquires a problem with the heart. In younger age group, it could be rheumatic heart disease, which we are commonly aware of, dilated cardiomyopathies and other rare diseases like Kawasaki disease. And in the old, we are well aware of coronary artery disease, dilated cardiomyopathies and other cardiovascular diseases. Now, why do we think this happens? As far as congenital heart diseases go, it's a multifactorial etiology. A very small part of congenital heart disease have a single gene defects, and very few, like congenital rubella syndrome, are preventable. But for acquired heart disease, what is the cause? And I think the problem is in that word, being. And I think we understand human, but we don't understand being. And I think children and babies thrive being, but adults over the course of their lifetime amass untold miseries and end up having a storehouse of stress factors. So if you look at the risk factors for cardiovascular disease, they are modifiable and unmodifiable. Of course, unmodifiable, nobody has a say on. You can't stop aging. Sex, male preponderance of coronary artery disease, And of course, where you are born and your genetics determine to some extent the chances that you may get a coronary artery disease. But if you look at the modifiable risk factors, smoking at one time was implicated heavily, but not anymore. Now the number one cause is uncontrolled stress. And if you look at that one factor, that is probably the reason for all the rest of the risk factors as well. So even though they say that these are all modifiable risk factors, if you control that one factor, that should ameliorate the effects of the other. Uncontrolled stress can cause physical inactivity, high blood pressure, dyslipidemia, can lead to obesity, unhealthy diet, and diabetes. So these are some of the things that we need to bear in mind. Enormous importance has been paid to these figures. Every time you go for a health checkup, you look at the total cholesterol. If it's less than 200, you're fine, but if it's more than 200, then you're labeled a dyslipidemic and you're started on medications. Your LDL cholesterol, rigorously told that it should be below 100. This is the bad cholesterol. And your good cholesterol, the HDL, you say that it should be more than 40. Triglycerides, less than 150. Enormous emphasis is placed on these numbers to the extent that we become paranoid with that, and then we are labeled for life as cardiac patients, with the result that you end up thinking that you are a patient and you go through life with that label in mind. If you look at the heart, it's a muscular pump, okay, and it's a pump which keeps beating non-stop throughout life, and like all muscles in the body, these muscle also needs oxygen and nutrients at a constant supply, and this is done through these two coronary arteries. You have the left coronary artery and the right coronary artery, which arises from the aorta, which is the main blood vessel that takes oxygenated blood to the body. And coming from that, these keep supplying the heart muscle. And if you have a block in one of those arteries, then the end result is what you call a heart attack or a myocardial infarction. If you look at a cross section of these coronary arteries in detail, the innermost lining of the coronary arteries is called the intima, and this intima is lined by cells called endothelial cells. When any inflammation can cause these endothelial cells to produce endothelin, which in excess invites deposits of lipid inside the lumen of the coronary arteries, and these lipids are what we call atherosclerotic plaques. And when these atherosclerotic plaques gradually obstruct the lumen of the coronary arteries, you get a mismatch between the supply and the demand of the cardiac muscle, with the result that when you are resting, the blood supply may be sufficient, you don't have any symptoms, but when you are exerting, like going up steps or running, your heart muscle needs more oxygen and nutrients, and the blockage limits the flow of blood to that portion of the heart muscle, with the result that you get chest pain, which is called angina. And this is just a cartoon which again shows how these plaques form. When these plaques continue to form over a certain period of time, they rupture. When they reach a certain level, they can rupture, with the result that the circulating platelets in the blood circulation can form clumps onto those ruptured plaques, trying to close the rent, and can cause complete occlusion of the coronary arteries. And that's when, depending on which part of the coronary artery is obstructed, you can get a proportionate ischemia of the heart muscle and a cardiac arrest. Now, what happens when you diagnose something like that? You go for a testing. the cardiologists normally do a coronary angiogram, which is accessing the femoral artery with a catheter, which is guided across the aorta into the ascending aorta, and the coronary ostium is hooked, and you inject radio opaque dye into the coronary arteries to give you an image like this. It gives you the morphology of the coronary arteries. So on the left you see a normal coronary artery pattern. You don't see any blockages. They are nice, and the inside of the coronary arteries are smooth. There is no blockages as such. And on the right you see a diseased coronary artery where you see a block here. And this is a result of the atherosclerotic plaques that we talked about, where the lumen is still patent, probably about 80% obstructed, 20% patency is there, so there is some blood flow distally. But if this ruptures and you have a complete 100% block here, this entire cardiac mass which is supplied by this coronary artery would suffer ischemia, would die, and you would have a massive heart attack. So what do the cardiologists do when you do this? When they see that, they would do what is called a coronary balloon angioplasty. You put a balloon catheter inside across the obstructed portion, inflate the balloon, and make the atherosclerotic plaque go away. If that is not feasible, if the plaque is hard, then you would put a balloon on this, you would put a stent on this balloon and keep it inflated permanently, opening up the blood, coronary artery blood vessel. This is feasible for conditions where there are discrete blocks which you can do stenting with. But if there are like multiple blocks here, 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 you can't be putting in too many stents, and then you seek the aid of the cardiac surgeon, who would go and do what is called a coronary artery bypass surgery. And there he would just put, if I can get it to play again, the surgeon just bypasses the areas of blocks and reperfuses the distal portion so that your symptoms go away. So this is in essence the coronary artery disease. A lot is being done with preventive cardiology. I quite like this slide. It says to prevent a heart attack, take one aspirin every day, take it out for a run, then take it out to the gym, and then take it out for a bike ride. So it's not just enough popping pills. You have to change your lifestyle. You have to go for regular exercises, and for that a change in mindset is very essential. And I think psychological counseling can help a long way in those kind of areas. Moving on to valvular heart disease. Rheumatic heart disease is a big cardiovascular burden in sub-Saharan and Asia Pacific regions. This is basically an sequelae of a simple streptococcal throat infection which affects the heart valves, most commonly the one on the left, the mitral valve and the aortic valve, with the result that they get either inflamed, thickened, and don't function very well. They don't open very well, they don't close very well, and you can get stenotic lesions or regurgitant lesions with very symptomatic effect on the patient. And many a times these patients are all normal. They just get a simple throat infection, they think nothing about it. 3 weeks later they come with symptoms of breathlessness and exertional dyspnea, and you diagnose rheumatic heart disease. And many a times it's the question is, why me? What have I done to get this? And we don't have the kind of psychological support that is required to treat these patients, because a lot of psychological counseling is required to make them compliant with subsequent managements in terms of penicillin prophylaxis, which is advised lifelong, as well as to undergo surgical or medical management. Moving on to congenital heart defects, which is much closer to my heart. The one on the left, the animation you see is a heart model with a hole in the heart, what we call an atrial septal defect. This is a hole between the two upper chambers of the heart. These are the two lower chambers of the heart. The left side pumps to the body and the right pumps to the lungs, and you have two outflows. The red tube, which is the aorta, takes blood to the body, and the right to the pulmonary artery to the lungs. And many of these simple holes in the heart are not sent for surgery now. They are closed with plugs which are done by the transcatheter route. So the patient does not have a scar, spends minimum time in the hospital, and they go home completely cured of the heart problem. So here the psychological stress on the patient or the parents are minimal, and the child can lead a normal life. They can grow up like a normal adult and lead a normal life. But consider this, I hope it plays very good. So this is what we call a complex congenital heart disease, or blue babies in other words. It's not a simple hole in the heart. There is a multiple conglomeration of problems within the heart. There could be a hole, there could be valve issues, and this is a condition called pulmonary atresia. This is a 3-day-old baby where I have done an angio of the pulmonary arteries, and you can see that this is the pulmonary arteries going to the left lung and the right lung, and the connection from the pulmonary artery to the heart is non-existent. The main pulmonary artery is absent. So of the two outflows from the heart, one is missing, and this is what we call a cyanotic congenital heart disease. This was done at 3 days of age, and here the life is sustained by what is called the patent ductus arteriosus, which is present for all babies when they are in the womb, and that is perfusing the lungs to keep life going here. And it's essential to do an intervention on day 3 and put a stent across that ductus to keep it open until such time that the child grows up and comes back for subsequent surgeries. And subsequent surgeries would all be major complex surgeries. So here a stent is being taken across the ductus, and here is a final injection after the ductus has been stented, so you can send the baby home to grow and come back after a year or so for subsequent surgeries. And it's not the end of that. As these child grow, remember that this child did not have one of the outflows, so you have to place in tubes which progressively are increasing in size as the child grows. So every 5 or 6 years this child needs a major open heart surgery, and think of the enormous trauma this places on the parents and the family as a unit. This is usually very young parents who most of the time in India are unaware of the diagnosis until after the baby is born, and then they come and have this diagnosis and be told that your child is going to need minimum of 3 or 4 major open heart surgeries over a period of time, and you will need to be on regular follow-ups and medications. Unfortunately, we don't have the kind of psychological support these families need in India as abroad. As one of the speakers rightly pointed out, we need to have an integration of these two fields, so that as a team approach these parents are counseled, and so that they know what the course of the life is going to be and what the support they are going to get. So moving on to the second part of my talk, cardiac psychology is not something new. Even as early as 1628, William Harvey wrote that a mental disturbance provoking pain, excessive joy, hope or anxiety extends to the heart, where it affects temper. And we know that extreme psychological stress, emotions can affect the autonomic nervous system, releasing catecholamines, which again increase your resting heart rate, depresses the vagal tone, and decreases the post-exercise heart rate recovery time. So these are all effects of psychological stress. Also, psychological stress is known to increase inflammation, and that can also lead one of the factors for leading to coronary artery disease. And we have proven papers which say that meditation and other modalities which calm down your sympathetic system actually improves the quality of life in these cardiac patients. So, is it all really in the mind? To substantiate that, I would allude to two studies. One is a controlled trial of arthroscopic surgery for osteoarthritis of the knee by Mosley et al. This was published in 2002, and what he did was he studied about 180 patients and divided them into three groups, all with severe osteoarthritis of the knee joint, quite symptomatic, and he divided them into three groups. One group he did arthroscopic lavage only, one group he did arthroscopic debridement, which was the proper treatment, and lavage being just washing the knee joint and getting rid of all the toxin stuff, and one group he did arthroscopy but did not do an active intervention, and he found that the symptomatic relief in all three groups, even the ones which didn't have anything done, was dramatic. And the second was percutaneous coronary intervention in stable angina called the Orbita trial, which was published actually last year, as early as last year. It was a double-blind randomized controlled trial from the UK where 5 centers participated. 230 patients were enrolled with symptoms. All of them had a single vessel coronary artery disease of more than 70% block, and these patients were randomized. Half of them were taken up for stenting, half of them were taken up for stenting, taken to the cath lab, but no stents were put in, and the end result that was studied was an increase in exercise time. And to their surprise, they found that there was no significant difference in the increase in exercise time in either group. So this tells, I'm not discrediting the management that cardiologists do. I'm not saying that stenting is wrong. It's just that there is a great role that mind plays in the patients getting better, and that needs to be acknowledged, which is what brings us to the work of the cell biologists. They've long been saying that cells respond to energy fields, even thought is an energy field, and cells respond to that with the cell receptor, the receptor proteins in the membranes, and you can have a biological reaction in the cell to a thought process, and that's science. That's not just ancient wisdom or anything. It's proven now. So it makes it easier when you look at this equation by Einstein, which is E equals mc square, where E is energy, m is matter or mass, which is you, me, this podium, mic, everything, and c is the speed of light square. So when you look at that, every matter has an energy field whirling at a very high speed, and that suggests that in this universe the quantum mechanics is really true, which says that the universe is an integration of interdependent energy fields entangled in a meshwork of interaction. So everything is energy, all the matter is energy, which is interactive, which is very interactive. So which says that it could well be all in the mind. Now, when we talk about the mind, we always think about the head, which is what we should move away from. This is a very beautiful book by Candace Pert. I'm sure the experts here would know that. She has done elegant work on this research and says that your mind is in every cell of your body. Again, with the help of receptors in the cell membranes, which work throughout the body, and a feeling sparked in your mind will translate as a peptide being released somewhere. Peptides regulate every aspect of your body, from whether you're going to digest your food properly to whether you're going to destroy a tumor cell. So what this probably means is I'm just not saying that positive thinking is going to give you the desired result always. It's even from personal experience. We all, as doctors, we all have patients who we think are not treatable or beyond care, and then they somehow spontaneously get cured and come back, and we think that's a one-off case. We can't explain it by science. And I think there is a role where the subconscious mind, if they make a firm belief of their values, the treatment they have, or the faith in the doctor, then I think that has a very positive role in the outcome. And that is something which we should take it into consideration. This is my last slide. It's a quote from APJ Abdul Kalam, one of the greatest minds that India produced, probably after Mahatma Gandhi and Swami Vivekananda. He talked about science and spirituality, and he realized that they should be considered together. And I think we would all agree with him and saying that the science of the mind and the science of the body should be integrated to give a holistic care to the patient. So thank you for patient listening. Thanks a lot. It makes it easier when you look at this equation by Einstein, which is E equals mc square, where E is energy, m is matter or mass, which is you, me, this podium, mic, everything, and c is the speed of light square. So when you look at that, every matter has an energy field whirling at a very high speed, and that suggests that in this universe the quantum mechanics is really true, which says that the universe is an integration of interdependent energy fields entangled in a meshwork of interaction. So everything is energy, all the matter is energy, which is interactive, which is very interactive. So which says that it could well be all in the mind. Now, when we talk about the mind, we always think about the head, which is what we should move away from. This is a very beautiful book by Candace Pert. I'm sure the experts here would know that. She has done elegant work on this research and says that your mind is in every cell of your body. Again, with the help of receptors in the cell membranes, which work throughout the body, and a feeling sparked in your mind will translate as a peptide being released somewhere. Peptides will regulate every aspect of your body, from whether you're going to digest your food properly to whether you're going to destroy a tumor cell. So what this probably means is I'm just not saying that positive thinking is going to give you the desired result always. It's even from personal experience. We all, as doctors, we all have patients who we think are not treatable or beyond care, and then they somehow spontaneously get cured and come back, and we think that's a one-off case. We can't explain it by science. And I think there is a role where the subconscious mind, if they make a firm belief of their values, the treatment they have, or the faith in the doctor, then I think that has a very positive role in the outcome. And that is something which we should take it into consideration. This is my last slide. It's a quote from APJ Abdul Kalam, one of the greatest minds that India produced, probably after Mahatma Gandhi and Swami Vivekananda. He talked about science and spirituality, and he realized that they should be considered together. And I think we would all agree with him and saying that the science of the mind and the science of the body should be integrated to give a holistic care to the patient. So thank you for patient listening. Thanks a lot.
This is called the placebo response.
Yeah.
And Professor Walker and myself have been discussing over the last 48 hours issues around the placebo response. And you've just alluded to the unconscious. And as I was saying earlier in my talk, this sort of psychoanalytic view, which is somewhat mysterious to the general public as to why a psychological process can result in a physiological change, is also explained by classical conditioning, as per Pavlov. There was a very interesting television program presented by another Mosley, Michael Mosley, on BBC television, in which they had a group that was told that they were receiving a sugar pill, not an active pill.
Okay.
And many of those patients actually got better, even though they knew it was not an active pill. So knowledge that something is a placebo doesn't necessarily stop the placebo response. And many psychologists think that the reason for that is not subconscious in the psychoanalytic sense, but is subconscious in the sense of classical conditioning, just like, you know, Pavlov's ringing of the bell with the dogs causing salivation. So there's a classically conditioned response has occurred. There's a similar effect in relation to mind-body relationships. So sorry, that's not really a question, it's a comment.
Well,
yeah.
I understand. You are probably more the expert on that than me. But some of these conditions, some of these holes in the heart that you think is never going to close, and then they close. And
you have no
there are a lot of
explanation.
things which science doesn't explain.
Exactly.
Even though you say it's conditioned reflex, I think there are some things which cannot be explained, and I think we do not understand mind as much as we should.
Yeah.
Especially when they grow up into adolescence, they need referral to occupational therapists. So I think you're well set.
Okay. The second question is that in one of your presentation you talked about interaction, and you said something about the mass, the matter, when you're doing the calculation or something.
Yes.
And you said you, the podium, and the likes. And in my profession, there's something called the PEOP model. That's the person, environment, occupation, performance model.
Yes.
And we believe that the person is to well-being as the environment is the quality of life.
Absolutely.
So
I think we are all part of the environment, and we should accept that. We are all part of the universe. We are all made from the same elements as the universe. I think the problem comes when we don't realize that.
Okay, so my question from there is this. Since I've been in India for the past 4 years, I've had some beautiful conferences talking about holistic approaches in different disciplines. But till date, I'm yet to really experience that holistic care, because even in my college, SRM University, we have very little referrals from cardiologists and other health discipline to occupational therapy. So how do we facilitate this holistic care or practice if many of other health professionals don't understand other multidisciplinary discipline? That's my question.
Good question. In the West, when I've trained abroad in the UK, we do have holistic approach to these cardiac patients. We don't just give them the medical diagnosis and send them home. They do get to see a psychologist, and they have so many other people coming in, forming a team and counseling them. In India, the problem is that healthcare is not centralized, and we don't have a central healthcare policy which can address all this. So it's kind of individualized. So unless the hospitals form a team, it's difficult.
Okay. Thank you very much.
Thank you.
Thanks.